This is the Less Insurance Dependence podcast show with my good friend Gary Takacs and myself, Naren Arulrajah.
We appreciate your listenership, your time, and most of all, we appreciate your intention to reduce insurance dependence in your practice. Our goal is to provide information that will help you successfully reduce insurance dependence and convert your practice into a thriving and profitable dental practice that provides you with personal, professional, and financial satisfaction.
Hello, everyone. Welcome to the Less Insurance Dependence podcast, the official podcast of the Reducing Insurance Dependence Academy, www.rid.academy. Membership to the Academy is a gift from Gary and I in appreciation for your listenership. Visit rid.academy and don't forget to register for our annual event. It's on October 24th. When you go to the rid.academy website, you will learn more about it. 5 hours of CE. We have amazing speakers. This is our 5th annual summit. So please check it out, sign up, and looking forward to seeing you on October 24th. Today's podcast is titled, Will PPO Plans Be Relevant in 10 Years? It's a really interesting and provocative question. I think it's making us think, okay, fast forward so many years into the future, you know what? Would we have PPO plans? And how would dentists practice dentistry? So Gary, I'm really excited to explore this. I know lots of changes are happening. The Reducing Insurance Dependence Academy, for example, has 1,500 members now. So like the people who are sick and tired of PPO plans is growing, and the people who are taking action is growing. So what do you think, Gary? What does your crystal ball tell you?
Well, Naren, I wish I did have a crystal ball on this one. It's a great question. Will PPO plans even be relevant in 10 years? And I'd love to just confidently say, no, they're going the way of the dodo bird. PPO plans are going extinct. I would love to be able to say that. I'd love to be able to back it up with data. However, I can't do that. And I don't have a crystal ball, but I do have a pretty good perspective on our profession. And I'll share with you some thoughts that I have. It's interesting. If you look at the evolution of dental insurance, Naren, the history of dental insurance only goes back to the mid-1960s, Naren.
Right.
So think about that. The mid-1960s, it's 50 plus years, of history. And in the beginning, dental insurance was created by dentists for dentists. What? Really? Right. And look what it's evolved to. Look at the what show it's evolved to today.
Right. Right.
I'll keep it G-rated to save our rating, our podcast, but it was literally started by dentists for dentists. And if you think about it, in the 1960s, the average annual benefit was $1,000 a year. Now, we have to go back in time to put that in perspective. Let's say 1965. So if someone got dental insurance benefits, dental insurance would pay up to $1,000 a year max. What did it cover? A crown in 1965 was $150 on average.
Right.
And how much is a crown covered? What percentage is a crown covered?
$150. If it's $1,000, pretty much.
But how much does insurance pay?
Half.
50%. It's always been covered at 50%.
Yes.
So if a crown's $150, the patient pays $75, the insurance company pays $75.
Right. And
if they have $1,000 of benefit, how many crowns can they get?
They can easily get
I'll do 12, the math for you. It's between 12, 13 and 14.
13 and 14.
13 point something crown.
Right.
Now, 13, let's round down, call it 13 crowns. 13 crowns is not a full mouth reconstruction. But 2 years with the benefits, they can have a completely restored mouth. Today, there are still some insurance policies that have $1,000 max. What does $1,000 max cover today with today's fees?
Not even one. Yeah.
One tooth, maybe.
Maybe. Yeah, exactly.
If it doesn't need a root canal.
Right.
If it needs a root canal, we're already out of the benefits by covering the root canal.
Right.
So it's really morphed into something that's a joke, an absolute joke. Now, more and more patients are choosing not to have dental insurance.
Right.
because they realize
I think
it's not insurance at all.
Half of the Americans don't have dental insurance.
Yeah, it's growing. That segment is growing.
Right.
People are choosing. It's very different than health insurance. We all need some health insurance coverage in case of some catastrophic event that would put us in the hospital.
Exactly.
I mean, if you're in the hospital and it involves a multi-night stay, we could be talking about hundreds of thousands of dollars, if not millions of dollars, depending on what's going on. Right. So we need insurance to cover that. And the health insurance is very different. But what I see happening is that consumers are much wiser today than they were. We read food labels. Remember the time when we didn't have food labels?
Yes. I mean, we had what do you call corn syrup, right? And everything. But now people were very careful of what they put in their mouth.
And there's, patients or employees that are realizing the benefit that the employer is foisting on them is really no benefit at all.
Right.
Is not a benefit at all in terms of what it covers. It's a free cleaning twice a year.
Exactly.
That's it. But it doesn't really cover any needs, beyond that. And it's so limited in what it covers that it really isn't a benefit at all. And so one of the things to ask your patients in your practice is ask them, is your dental insurance provided as a benefit of employment, meaning your employer is paying for it, or do you pay for it yourself in the form of a payroll deduction? You know what most people say when you ask them that question? I don't know.
Right.
Well, you could say, look at your pay stub and see if you're paying that in the form of a payroll deduction. If you are, tell your employer politely, I don't want that anymore, and encourage the patient to purchase your membership plan.
Yeah, that's what $250, $300, $350. It's a peanut.
Your membership plan is so much better. Without the rules, without the games, without the restrictions. Right. And if they're paying for it themselves, they're getting a much better value by buying your membership plan. The other thing you could tell the patient, if they really have a lousy plan, and most of them are really horrible, talk to your benefits supervisor at work. This is assuming it's provided as an employer benefit. Talk to your benefits supervisor at work and let them know you're not the least bit happy with this dental plan. And imagine a group of employees bringing that message to the benefits supervisor. And by the way, if you're an office that happens to know of a good plan, because there are some good insurance plans that pay good benefits, say, have them switch to this plan. Encourage your benefits supervisor to switch to this one that's actually a better plan.
Right.
But you can create a lobby in the form of your patients by telling your patients, let your benefit supervisor know that this lousy Delta plan, wait, did I say Delta? Yeah, I did.
Yes, you did, Kenny.
Yeah, I did. That wasn't an accident. The Delta plans are horrible, are absolutely horrible. They're paying less and less and less. Their reimbursements going down, not going up, in the face of ever rising inflation and wage inflation in particular. Delta has the nerve to lower your fees.
Exactly.
And as a result of that, Naren, there is a groundswell effort afoot of dentists, groundswell individual, effort of dentists just saying enough's enough. I can't make this work. If you do the accounting in your office, if you actually do cost accounting, you may discover on many of those really bad Delta plans, it's costing you money to provide your patient's care. If it's costing you money to provide your patient's care, does it make any sense to have that plan in your practice? No, not at all. So my crystal ball, I'll come back to the question at hand. My crystal ball says that we're going to see some changes coming up because this current system doesn't work. It doesn't work for the dentist. Think about the entities that are involved in dental insurance game, Naren. There's the dental insurance company,
the patient
policy.
Yes.
There's the dentist, dental office that provides the care. There's the patient that receives the care, and there's the company that buys the policy. That's it. That's the four entities in it. The only one that wins today is the dental insurance company. And by the way, this has sort of been disclosed that the insurance companies are the only ones that win. How's that been disclosed now? Think about some recent events. What are some recent events that have disclosed the dirty secret that insurance only works for the insurance company? What are some events that have occurred
I mean,
in public perception?
yeah, are you talking about what happened in New York?
Yes.
Yes. I mean, that's, I think it's kind of.
Go ahead and define it.
You mean the murder in New York, the person who was shot?
The assassination. Yeah.
The CEO of one of the top dental insurance companies, right?
No, it's a health insurance company.
Health insurance company, yeah. And of course, the public outcry, there's a lot of people who was quote unquote, even though I'm not a fan of this, like who was kind of on the side of the vigilante.
Well, you can't be a fan of vigilante justice.
Yeah.
But when they discovered that it was, look it up on Google, but I believe it was United Healthcare. Would you look?
I think you're right, Gary.
I'd like to confirm it for sure for our listeners.
Yeah.
But I believe it was United Healthcare, and they discovered that in the previous year, hundreds of millions of dollars of claims were denied because of the use of AI.
Right.
And what kind of light does that shine on the insurance company?
Poor light, for sure.
Yeah. Think about
the gentleman who was killed was Brian Thompson.
Brian Thompson, was it United?
Yes, United Healthcare. He was the CEO of United Healthcare at the time.
There's 3 NFL stadiums that are named after an insurance company. Now, why do insurance companies do? Why do they want to name a stadium?
Marketing.
For who? For patients?
No, for the companies, because they want to give them the box. So when the CEOs of these, employers show up, they can, give them a box at the game.
Yeah. So they pay hundreds of millions of dollars in naming rights instead of benefits to the people that are insured.
Yes.
And the public has gotten, you're not in good hands. Do you remember that slogan? You're in good hands.
Good hands. What is that? State Farm.
You're in good hands with State Farm. You know what? You're not in good hands with State Farm. So they, the public is becoming more savvy. And I think that there's an effort afoot to really make PPOs become obsolete, at least in the way they're designed today. It's not a win-win. It's a win-lose.
Right.
And when insurance companies are making hundreds of millions of dollars of profit on insurance, I mean, I am a capitalist. I'm in favor of profit, Naren.
Right.
I am. You are too.
100%.
So are our listeners. Hopefully they're running a profitable enterprise in your dental practice. By the way, if you're not running a profitable enterprise, schedule a coaching strategy meeting with me so you can get profitable. So we're all in favor of profit, but I think the difference between a dentist in favor of profit and an insurance company in favor of profit is ours is beneficial profit. We profit by actually providing good and taking care of people. The insurance company provides good by taking advantage of people. The medical loss ratio, MLR, do you remember that initiative, Naren?
Yes, MLR, yes.
It was 2022. It was a ballot measure in the state of Massachusetts that the Massachusetts Dental Association got enough signatures to put this on the ballot. And the ballot, if it passed, and of course it did pass, would require dental insurance companies to also have a loss ratio, meaning that they'd have to pay a certain percentage of dollars taken in for claims, for premiums, paid directly for patient benefits. And before this existed, they were only obligated to pay around 50%. So in other words, 50% of the revenue they took in from premiums had to be paid directly to policyholders, to patients. And now, because of the medical loss ratio getting passed, the ballot, by the way, it was an overwhelming landslide win for the medical loss ratio. They now have to pay 80, I believe it's 84%. It's either 82 or 84% of every dollar that's taken in on premiums.
Right.
And I think we're going to see more of that. And when we see more of that, it's going to change the face of insurance. So I think the future is going to change. I think it's going to get better. I see this as kind of the low water mark. I guess it can't get any worse until Delta cuts the fees again, which they're going to do. So there it gets worse. But what can you do now if you don't want to wait around for 10 years and see what happens? What you can do now is successfully resign from PPO plans. That's what you can do to be in control of this. And there's more and more dentists that are doing that individually. They're doing that. Just enough is enough. And it's getting harder for patients to find offices that accept their PPO plan. And when that happens, things will have to change.
Right.
Because the benefit, if you can't find anywhere to go that will take this bad plan that your employer is foisting on you, that's going to force some change. But it really is going to change the nature of that. But what you can do now is successfully resign from PPO plan. Remember, you don't have to go all the way to fee for service. We call it reducing insurance dependence, like the name of this podcast, Less Insurance Dependence Podcast. Less insurance dependence. You don't have to go all the way, because every time you successfully resign from a plan, you've strengthened and improved your practice. Naren, I'll let you have the closing comments. What do you think about my prediction? My prediction is that it's going to change, and it's going to be forced to change because what we have right now doesn't work.
I agree with you, Gary. I mean, obviously, already we know the number of doctors who are literally saying enough is enough and leaving insurance PPO plans. There's a huge groundswell of interest in reducing insurance dependence, and every literally week we see people getting on this journey, and some have dropped 1, some have dropped 15 plans. We are also noticing, like you said, the patients saying enough is enough, and half of Americans don't even have dental insurance. So I think these trends have been going on for the last 10, 20 years. I think they're just getting faster and faster and faster.
Well, everything's accelerating.
Yeah.
Peter Diamandis, talks about, the rapid acceleration of change. And this is another example of it. The PPO heyday when, the PPO plans were in control, we're already past that.
Yeah. And we're
already past it.
I think the last thing that's driving this trend is, especially after COVID, I think people are taking health a lot more seriously. And I think the relationship, especially with a dental practice, a good one, a relationship-driven practice, has grown exponentially because, that's the closest healthcare relationship they have. And everyone is starting to understand the oral systemic connection and how important oral health is for all kinds of reasons. So I do think these are not reversible trends. I mean, are people going to be less knowledgeable and less interested in their health into the future? I don't think so. These are all trends that are accelerating. So I agree with you, Gary.
Yeah. Well, at the risk of sounding self-promotional, I'll do it because I'm so passionate about it. If you're sitting there wondering what the world to do today, not waiting 10 years, schedule a coaching strategy meeting with me. Go to thrivingdentist.com/CSM. That meeting will be with me. And we can talk about your practice, and we can talk about some steps you can take. Whether you become a client or not, you can take some steps to improve that. And there's no reason to wait. I don't like to be passive in this. There's no reason to wait with things that are outside of your control. What's in control is your practice format. And we've worked with practices in all 50 states. Over 400 practices successfully resigned from PPO plans in every locational environment: urban, suburban, large town, medium-sized town, small town, remote, rural, company town. And we've been successful reducing insurance dependence. And every time we resign from a plan, it strengthens your practice. So no need to wait. Go to thrivingdentist.com/CSM, stands for Coaching Strategy Meeting. Would love to meet you there and talk about how this might apply to you. On that note, Naren, thanks for your thoughts on this topic. And thanks to all of our listeners for the privilege of your time. Naren and I look forward to connecting with you on the next Less Insurance Dependence podcast.